I've worked very closely with all of the 15 or 14 other chief officers of the AHSNs over the last year, where we've been looking quite deeply at what does our future look like in terms of the impact we can have? How could we grow the impact we have? How could we really make sure we're focusing on the things where we uniquely add value as academic health science networks working together at a national level? And what we heard through that process of thinking about that, talking to our stakeholders, our commissioners, the people we work with, is that challenge of identifying things that are of value, helping the health and care system then adopt those at scale so they have impact both on population health and economic growth, is exactly the area where I think AHSNs have a unique capability that we've developed over the last 7 or 8 years that perhaps other parts of the system really struggle with. So that's the role as a national network that we're really committed to focusing on. And we do that in a few different ways. So at a regional level, I think we've all developed different types of deep relationships with the integrated care systems that are forming in our region and the providers and commissioners that we work with. And that then enables us to do a combination of two things, really. So firstly, it enables us to work deeply in a region to identify and test and develop things that are really valuable to our region, whether that's new technologies, new service models, new ways of improving patient safety, and then look at bringing that together with a much more nationally coordinated way of working as a system of AHSNs. And that, as you mentioned in your introduction, that's the balance of the work that we now do, is both deep within our regions, and we really can't do the work we do at a national scale without the depth of relationships, without the depth of understanding of the places that we work. But the power now is connecting that at a national level to work on a small number of things that we really want to try and achieve at a national level as well. So our portfolio of work now as a national network of AHSNs consists of both a set of national programs, so that includes our work with the Accelerated Access Collaborative and working around rapid uptake products, and our national programs around things like ADHD diagnostics, around eating disorders and patient safety. But it also includes in the regional work we do, where we're trying to get deeper into the specific issues of our regions and develop potentially new national programs for the future as well. So I think that combined focus of both depth of regional work and understanding, combined with adopting and spreading nationally relevant, impactful innovations at the same time, is where AHSNs are most valued. And I guess the final thing I'd add to that in terms of how the evolution has grown and the importance of that national coordination that we now have, is that none of that would be possible if we didn't have the breadth of commissioning relationships that we do. So we have a number of commissioning relationships across all AHSNs, and that includes our work with the Office of Life Sciences, which is where our world with health and life science systems really kind of is most significant. That helps us to build a pipeline and understanding of all the innovations that are coming into market that have the potential for value for the health and care system. But if we didn't have those deep regional and local relationships, we wouldn't be able to then really do that matching of what is really meaningful to the systems that we work with, what will it take to actually put these things into practice, and bring that together with things that are nationally relevant or achieve impact at a national scale as well. I think, final thing I'd say is I'm really proud of what AHSN achieved, and largely why I came back to AHSN is I think there's been huge growth and development of how we do that. And you look at some of the things we've achieved over the last few years. The work that we've done has benefited nearly 250,000 patients over the last year alone, and our combined economic impact over the last 3 years is nearly £1 billion worth of inward investment leveraged, and nearly 3,000 jobs created or safeguarded over the last few years as well. So that dual aim of reaching patients, having an impact, but also having an impact on economic growth, I think is really starting to be demonstrated at scale now, and in practice as well.